The prevalence of highly publicized racial violence is having a negative impact on the mental health of Black Americans. That's according to a recent study published in the Proceedings of the National Academy of Sciences of the United States of America. It says, quote, reducing racial violence, including police killings of Black individuals, is likely to benefit the mental health of Black Americans. The George Floyd Justice and Policing Act of 2020 includes several provisions that could help limit police brutality, but the bill remains stalled in the Senate. For more on this, I want to bring in Dr. Ayana Jordan. She's an assistant professor of psychiatry at Yale University's School of Medicine. Dr. Jordan, welcome. Thanks very much for being with us. So, highly publicized instances of racial violence, including several police killings of Black Americans, have taken place over the past year. What mental health issues might Black Americans be facing as a result, and what can people do to cope?
Yeah, no, thank you so much, Elaine, for having me and covering such an important topic. Really just based on the article you just talked about, I think it's important to understand that you can have poor mental health symptoms as a result of being directly affected, right? From racism, but also through vicarious trauma, which we're seeing, right? The police brutality, the killings of Black people. And so wanting folks to understand that it doesn't necessarily have to happen directly to you, but just seeing people that look like you, in this case, Black people who are being killed or being victims of state-sanctioned violence can cause poor negative mental health outcomes. So those things look like difficulty sleeping, right? Poor concentration, irritability. Sometimes there's this sense of survivor's guilt. Why are people that look like me being killed and I somehow have survived? So a feeling of helplessness or hopelessness. And one of the things that study showed that you were just talking about is that when they actually compared mental health outcomes for Black people versus white people, Black people had more negative mental health outcomes. So it's really serious, and it's something that we need to think through. How can we be more intentional in reducing the, obviously, violence towards Black people, but also the coverage, the constant coverage of seeing Black people killed can indeed cause negative mental health outcomes.
Yeah, it really has been this sort of constant stream. And, you know, for a long time, the topic of mental illness has been stigmatized, including in Black communities. But recently, many high-profile Black Americans have publicly shared their own mental health battles. Most recently, tennis star Naomi Osaka revealed that she struggles with anxiety and depression. How might her story, doctor, and others like it impact the Black community?
Yeah, I think, you know, in terms of thinking about the courage and the you know, how brave you need to be to come out publicly to talk about mental health struggles really has elevated the conversation. So just because of Naomi sharing her story, so many people have reached out, friends and family members that I haven't talked to in a while, just to say, wow, what do you think? Do you think that this is actually real? I had similar symptoms. Do you think I need to get treatment? So really raising visibility that wealth, right, and fame cannot protect you from developing mental illness is really powerful. And so not only is it elevating the conversation, but it's allowing people to see that you can indeed seek help. And as Black people, you can protect your boundaries. And I think what was really tragic about the Naomi Osaka story, I'm glad that she was able to hold that boundary, but you see how even when she was very deliberate in protecting herself, there were fines that were placed against her, and then it resulted in her not being able to, you know, play in the tournament. But that just shows you how serious it is to protect yourself at all costs, right? Mental illness and mental health struggle is real, and being able to see her elevate the conversation and protect herself and say, no, I am not going to sacrifice my psychological wellness for fame or money is super important. And I think we're seeing more and more people come out and talk about their mental health struggles and normalize it. I'm really excited about the documentary that Oprah's producing, and then the conversation with Meghan Markle about her struggle with suicidal ideation or suicidal thoughts, right? Thinking, and really saying that if you are dealing with these struggles, it is okay to seek help. Mental illness is not just a white disease or those that affect the upper middle class. It does not discriminate. And so really having her speak out has really elevated the conversation. And I'm glad we're here talking about it tonight, for sure.
Yeah, it is so critically important. You mentioned seeking help. So several reports show therapy is growing in popularity among Black Americans. And during the pandemic, many people have turned to app-based therapy. Doctor, is that kind of therapy as effective as traditional therapy? And what factors should people consider if they're trying to choose between the two?
Yeah, Elaine, I love these questions tonight. One of the things is
my
can't
producer
really
Ayana, who is also named Ayana, as well. Very thoughtful.
Right,
it's an important discussion.
Exactly. Well, one of the things is we can't really talk about effectiveness if we don't do the studies to compare traditional therapy when one goes into the office to these app-based therapies. So I can't say is one modality more effective than the other because the studies haven't been done. But what we are able to know is that app-based therapies are more accessible. In this country, unfortunately, it's very difficult to get mental health coverage. And even if you are insured to have mental health access, trying to get an appointment with a mental health specialist or someone like me, a psychiatrist, can take months and sometimes even years. So one of the positives of app-based therapies is that it's right at your fingertips and it's way more financially accessible. And so what I say to people is, it is effective if it works for you. If there is a improvement in your overall mood and your overall health, you're able to engage with this therapy on a consistent manner, then that's how you can really assess for yourself, is this working? Some important things to consider, though, with these app-based therapies is, what is the quality of the therapist? I know sometimes folks who have not gone to schools for mental health treatment don't understand that not all training is created equal. So really wanting to do your due diligence and ask the therapy apps, how do you credential your therapist? Where have they been trained? Are you using evidence-based therapy? So there's many different types of talk therapies, right? There's dialectical behavioral therapy, supportive therapy, cognitive behavioral therapy. So you want to make sure that your therapists are using treatments that actually have evidence behind them, and feeling very empowered to ask these questions before you engage in app-based therapy is really important. And so really wanting to encourage people to do that, because again, it can be extremely helpful, but you need to know that you're working with people who are properly trained.
Right. People need to do their research. Finally, Doctor, you co-authored a report published in The Lancet, which shows police officers are more likely to kill Black Americans who show signs of mental illness than white Americans who show those same signs. Why are Black Americans living with mental illness more likely to be killed by police? And what do you think needs to be done to address this problem?
Yeah, I'm so grateful for the coverage that we got on that article. And I just want to say that the intention behind involving police in addressing acute mental health crises was one that was based in wanting to do well. But I think what people have to understand, when you're marginalized in this country and you're minoritized and treated less than, especially Black people, and then have a mental illness on top of that, you have to weigh how racism plays into how people are treated differently. And so when you're thinking about involving police into an acute mental health crisis, you have to consider that Black people are more likely to automatically be thought of as more violent, more dangerous, right? And so we know that police, even in the absence of a mental illness, are more likely to use weapons or more likely to shoot. And then when you have mental illness on top of that, it increases the anxiety and likelihood for violence. And so one of the ways that we advocate or we talk about really allowing the evidence to guide what we do is to remove police from mental health treatment, right? So police have other things that they need to do. They don't need to be involved with really taking care of people who are going through an acute crisis and leaving that up to the professionals, right? So psychiatrists, psychologists, social workers, community workers that are trained. And what is really awesome that we talk about in this paper is just thinking about programs that exist already that are looking to see how can we think proactively about taking care of people who are in mental health crisis who are Black and not involving the police. And they're showing that they're getting really good outcomes. Those are things like the Cahoots study that's going on in Oregon. And actually in New York City, there's a pilot program where they're looking at not involving police at all and responding to acute mental health crises to see if there is less violence as a result of not involving police. And so I think what people have to understand is the police are trained, right, to detain and to inflict harm and if they feel like they are threatened. And unfortunately, because of personally mediated violence, Black people are thought to be inherently more violent, and we know that's not the case. So one of the things we say is just allow police to do other things and leave mental health treatment up to the professionals.
Right. We know these are the kinds of questions that are being discussed in communities across the country. Dr. Ayana Jordan, doctor, thank you very much for sharing your insight with us. We really appreciate it.
Yeah, thank you for having me.